first thing is that I see that NCDs, we call it a lifestyle disease. Do we treat it as a lifestyle treatment or a care? Is the first question that we need to answer. I think the first thing is few shifts which are necessary, not necessarily a pura parivartan, I mean complete change. I'm saying that the existing system would continue, but there are certain modifications which are very critical. One is that we keep talking about compliance and adherence. So we suggest that here is some Krishna who is a daily wage worker who is 38 years old. He comes to the primary health clinic and the doctor says that, okay, very good, you got diabetes, it's a beginning of the diabetes, and here is your month's prescription tablets. You go back and do have healthy food, you do exercise, okay, and you come back after a month. The guy listens, nods, he doesn't come back. And why does he come back? Now, system would very simply say it's a non-adherence case, okay? But he doesn't come back because his coming to the PHC or wherever cost a day's wage. It's an economic problem. So he would select the first option to ensure his livelihood is not affected. Secondly, he's living in a family or with even a peri-urban context with 5 other laborers he's sort of living. Now his food habit cannot be changed overnight from X to Y, because it's everybody's food habit will change. It's not the food is cooked for individuals. It is not by choice. It comes from a common budget. All that factors need to be taken into consideration. So in other words, how do we make the system addressing the lifestyle issues and make it compatible to the patient's requirement? The lifestyle is something that the system needs to look at. Can we extend that month's prescription to maybe 2 months, 3 months, so the person doesn't have to come back? Can he get his medicine from the community-based distributor? Or for that matter, after 12 hours of daily wage work, if he has to do exercise, it's a bit of a ask, So I think our prescriptions, our system doesn't sort of address the lifestyle issues that who they are talking to. It's a one size fits all kind of a prescription that goes out.